Now, a new electronic patient workflow system has been put into place at the Elizabeth Donkin Hospital in Gqeberha. The idea behind the system is to cut down on physical documents, easing the admittance process right through to ordering meals while in hospital. The patient's medical record and hospitalisation history is thus digitally recorded and stored. Lerato Fekisi filed this story.
Good morning. We are broadcasting from Gqeberha, where we are bringing good news that the Department of Health is changing the way it does the filing system at the psychiatric hospital. Just in layman's terms, to break it down for you, what they're planning on doing, what they are going to do going forward. Back in the days, they used to capture information of patients with the filing system, the papers, and now they're moving to one online system, trying to make sure they keep up with the digital age. And we're joined this morning by Dr. Wagner, who's the HOD of the Department of Health. Tell us more about this innovation. Why the importance to move even the health facilities onto the digital space as well? Really, let's just first talk about the system and how important it's going to be to capture the patient's information now in a digital system.
Thank you, Lerato. As you were saying, we used to do a manual capturing on a registered piece of paper and have a manual paper file. What we're now moving to is an electronic capturing of that record into a central master base. So all 7 hospitals in the Nelson Mandela Metro now have the patient administration module and the revenue module. That means that when a patient presents to one of those 7 hospitals, we only register the patient once. So if a patient comes to Livingston Hospital and now is presenting and referred to Elizabeth Donkin Hospital, at Elizabeth Donkin, the patient clerk would be able to go onto the electronic system, quickly search, find that patient record and have access to that record. That means we only register the patient once, and any other time after that you can go and quickly retrieve it. It reduces the time for the clerk, but it also reduces the waiting time for the patients, because we already would have captured the information and we have now better, more accurate data. Here at Elizabeth Donkin, we've also gone the step further in that we've got the ward-based module that we've implemented. We've customized it to a psychiatric hospital because in the psychiatric hospital it's predominantly admissions of patients and inpatients. And here we now are able to electronically have a real-time view of all of our patients. What are our usable beds? What numbers of patients have been admitted to the different wards? Therefore, how many ward beds are available for admissions? We also have developed a module where the doctor can have the clinical notes recorded in the patient file, as well as track whether investigations have been done, whether those investigations have come back, and so forth.
Now, we always talk about the 4th Industrial Revolution. I think this is definitely a step towards that. Just going forward now, we're going to see a more move of this specific sector moving onto the online space to keep up with the digital age.
Yes, absolutely. So in the roadmap ahead, we're going to be coming out with a new version. Firstly, within the Nelson Mandela Bay, we're going to take the existing HMS2 application. We're going to be rolling it out within the Nelson Mandela Bay and expanding on the clinical modules. So that means we can now do an assessment, record that assessment of the patient electronically. We'll be able to record the diagnosis, record and request investigations and the results that have come back. And then also we can do referrals for x-rays. We can have a discharge note that goes with the patient or be emailed to a patient. So that's all fantastic. That already exists, and we're now going to be rolling out that second phase, utilizing those modules within the Nelson Mandela Bay. Our roadmap for HMS2 into the future is in November of this year, we're going to be introducing the inter-facility transfer. So doctor will be able to request a transfer from another doctor at another hospital in another ward or application. In January of 2022, we're going to look at the electronic identification and eligibility of patients. So we're interfacing with the EDI system. That means that if you come, we can quickly do a credit check. We can do a check to see whether or not you have medical aid, because that becomes important when we need to bill the patient. And we're also going to be working with Home Affairs so we can do an ID check. That's all scheduled for January of next year. And then in the second quarter, we're going to be looking at the use of a biometric system. You know, sometimes patients present and they are unconscious when they do present, and so they're not able to give their information, but we could then use their thumbprints, access the records of Home Affairs, and be able to identify the patient.
Well, that was Dr. Wagner, the HOD of the Department of Health, just speaking about the way in which the specific department is moving towards the online system, making sure that they keep up with the digital age. Just to also inform you that this forms part of a 2-way visit by the MEC of Health, Dr. Meth, who is also here to open the first of its kind emergency service college here in Gqeberha. So later on, we'll be speaking to her about the importance of the emergency services, something critical to us in Gqeberha here, especially amidst of the COVID-19 regulations. So good news coming here, a digitalization of the psychiatric hospital, also the one first of its kind emergency service college opening here in Gqeberha later on this afternoon. But for now, let's go back to you in studio.